It is not the difference between south and north. Actually, it is the difference between city and rural. The moment you cross the city and go to a rural place, whole India is the same. At the bottom, you have villages, right? India is nothing but villages. One good ICU in every taluk. That's what we have been, breathing in and out as our mission statement. More than 60% of the district headquarters and also more than 90% of the taluk headquarters, they don't have standardized ICUs. Standardization, I mean that the policies and processes in ICU that are to be followed exactly what the international guidelines say, which are usually followed in city hospitals, corporate hospitals. In rural, most of the problems are seasonal infections, agricultural poisoning, suicide attempts, average level accidents, not major accidents, things that are required in an ICU to be used. In a city hospital, it is handy, it is immediately available. Whereas you go to a rural hospital, if a doctor wants to set up an ICU, he has to fight and struggle for everything because the hospital owner or the ecosystem, they don't know about it. When rural patient has to travel 2 hours, 3 hours to go to a city, there he takes a long time to recover. It is, although the care is better in city ICUs, the problem is by the time the rural patient goes there, the golden hour is gone. If they miss that bus and they have to travel another 1 hour or 1.5, 2 hours, something like that to go to city, even though they survive, they need at least 3 to 5 days more to recover. One thing is they have to spend more money on that. Second thing, you take more time to recover. Third thing, you are devastated more, and your recovery in your life, even after discharge, to come back to normalcy will take a long time. Today, there is no problem for heart surgery. There is no problem for angiogram and angioplasty. There is no problem for dialysis because they were recognized as separate entities and there is a provision for it. But if a patient has to get admitted in ICU and treated for 10 days, 20 days, there is no provision from government side to be taken care of in those situations. The moment you start supporting that, then normally even the small hospitals will start, having their own ICUs. So that will actually take away the burden on the patient.
As you said, sometimes the treatment can go up to 20 days. So do we have any policy on how to control this out-of-pocket expenditure in the ICU?
In India, the system is that it is from the pocket of the patient or the relatives. You go to US and UK, it is completely free. Non-affordability will never come into picture in the management of patients and decision-making of patients, care in ICU. Whereas in India, the non-affordability, unfortunately, is a major player in decision-making. Today, I don't see that many states, in many hospitals, government or private hospitals, even the government health schemes are covering ICU admission as a separate entity. ICU has to be recognized as a separate department. Now, if there is a fracture and surgery, after which patient lands in ICU, and ICU takes 20 days, there is no policy that is covering this expenditure.